So, are minorities affected by our current healthcare system? Let's jump into it. My name is Dr. Erica Steele. I am a holistic doctor in family practice. I hold 6 degrees in my field, and they're all in the natural healthcare space. I chose to be a drugless doctor, and I went to school so you don't have to. All right, so let's jump into it. First thing, we know that healthcare is a fundamental for everyone, regardless of your race, ethnicity, or even your socioeconomic status. Unfortunately, minorities are disproportionately affected by our healthcare system. So let's talk about it. Why? First, let's talk about the higher rates of chronic disease, such as diabetes, hypertension, and heart disease, also higher rates of infant mortality, and lower life expectancy than non-minorities. So it's important to address these health disparities and promote health equity for everyone. Now, there is some challenges, even in our healthcare system. Minorities are often affected by healthcare disparities, such as a result in poor health outcomes, increased morbidity, and mortality rates, which we discussed. For instance, African Americans are twice as likely as non-Hispanic whites to die from heart disease and stroke, and they have higher rates of diabetes as well as hypertension. Similarly, Hispanics have higher rates of diabetes, obesity, as well as cervical cancer, and even Native Americans have higher rates of infant mortality and higher rates of chronic diseases than the general population. Minorities often have limited access to preventative care and medical treatments, often due to economic and social barriers such as poverty, lack of health insurance, and language barriers. There's even just an overall access issue that can really result in untreated illnesses, misdiagnosis, and delayed treatment that can lead to worsening health outcomes. Addressing these health disparities requires a multifaceted and a holistic approach. It's really an approach that increases that access to healthcare services and preventative care for minorities, improving health education and literacy, addressing social determinants of health, increasing diversity in the healthcare workplace, and of course, addressing systemic racism and discrimination in our healthcare delivery system. So as a holistic healthcare provider, I often see these healthcare disparities among minorities as a significant issue that requires action and attention to detail. And if we do address it, we can promote the health equity and ensure that everyone, regardless of race, has access to quality healthcare services. I find that oftentimes I'll work with people from all different walks of life, all different races, all different religions, all different cultural backgrounds. And a lot of times when they're seeking healthcare services, they're gaslit, they're not heard, they're dismissed, or even a lot of the treatments are not necessarily in alignment with their cultural beliefs. Oftentimes, let's say, for instance, metformin, which is a popular drug used for diabetes care, that can often create lots of side effects for minority patients, more so than our non-minority patients. These side effects that people are experiencing are often dismissed or not heard of, or, oh, you'll get fine, or raise the dose, or even they just change to drug after drug. And there's a real missing in understanding what actually makes our bodies a lot different than our non-minority counterparts. Our bodies simply cannot handle a lot of the toxic loads that a lot of these synthetic drugs have, and we really need to learn more about our nutrition, our emotional health, as well as really dealing with our ancestral trauma that has been passed down through our DNA, which impacts our emotional health, our mental health, and then of course is going to impact our physical health as we don't learn how to take care of ourselves early on. There's a lot of big issues we're going to be talking about over this month in April, and I look forward to really educating you more about how these health disparities really affect minorities over the month of April. Awesome. Have a wonderful day.